Hello and welcome to Parkinson Place and to Parkinson Power, which is a series of all different topics with the goal being to help you to be your best and to live well with Parkinson's disease. Today's topic is how to maintain self-respect and dignity. Can you think of anything that's more important for any human being than their self-respect and dignity? I really can't. So let's start talking about number one, self-respect and dignity for the Parkinson patient. But just like every other topic that we talk about, we're going to be also discussing self-respect and dignity for the caregiver. Self-worth is critical to any human being, and many times with a Parkinson diagnosis, just because of the overwhelming side effects, the changes that happen, it can really affect a human being's sense of worth and sense of esteem, even can lower the confidence many times. Let's talk about the different side effects of Parkinson's disease and the open appearances that are very notable to the public and to people around you. We all know the tremor. The tremor is very common. It's just that pill rolling tremor that cannot be controlled. Then we talk about the difference in the gait. We talk about the weakness in the trunk. We talk about the rigidity of the muscles, the shuffled gait. And then you layer that with sometimes the masked face. We all know that Parkinson patients many times don't smile or appear laughable. Their face is more rigid because of the muscles in the face. You don't blink as much. So sometimes Parkinson patients feel that they might look a little different than the normal person out in the community. And that can very easily affect how you feel about yourself. But I don't want you to let it, because self-respect and dignity is yours alone. It's something that this disease cannot take from you unless you allow it to do so. I want you to always remember the common goal, the mission that we have with our thinking, with our positive attitude and our sense of control. I want you to always go back to the empowerment statement that I have Parkinson's disease. Parkinson's does not have me. That's the thought process that I want you to hold on to. And if you do that, the empowerment, the motivation, the positive attitude will help you to stand tall with this disease. And when I say stand tall, that means that you get up every day and you face it to the very best of your ability. It's very important that you stay engaged, that you stay active, that you hold on to your life, and that you hold on to your sense of self. Now, my caregivers, it's very important for you to understand as you go along day by day, step by step, hand in hand, helping your loved one. It's very important the way that you treat them and speak with them. The goal of a caregiver is not to cut meat and tie shoes. My feeling is the number one goal, the number one mission of a loving, dedicated caregiver is to maintain the self-respect and dignity of your loved one. And I already spoke just briefly a minute ago about how this disease can impact someone's sense of self. So many times they do lose their esteem, they do lose a sense of dignity because of the need to be dependent and the need to reach out and ask for help along the way. So between the physical dependency and the physical changes in the appearance, the self-esteem can be altered. So caregivers, please realize that many times esteem has been lost with your loved one, and you are in a key position to give it back and to maintain it. So it's very important how you treat your loved one. Remember that patients and caregivers are partners. They tag play, they team play, they work together. One pushes, one pulls, and vice versa. My Parkinson patients, you have a huge responsibility to your caregiver to maintain them at the highest possible level, to help them, to encourage them. You don't have the permission to just sit back and let everything be done for you. So let's talk just a minute now about how we can maintain self-respect and dignity for a person living with Parkinson's disease. Truth be told, the more that you do for yourself, the more under control that you feel. The more under control that you feel, the more dignified and the more confident you feel. So it's very important, my Parkinson patients, that you focus on doing absolutely as much as possible for yourself. You will feel good about yourself. You will build your esteem. You will build your confidence if everything that you can do during the course of the day, from waking till going to bed at night, anything that you can do or accomplish for yourself, I want you to do it. Might take you a little bit longer, but that's okay. You set yourself up and you do for yourself. Remember, the more you do for yourself, the more under control you will feel. The more you do for yourself, the easier you're going to make it on your caregiver. Now, my caregivers, I want you to realize when you're helping someone, when you're helping a loved one with Parkinson's disease, you are taking care of an adult. You are not taking care of a child. Why do we do so much for little children? Because they don't know how. They don't know how to feed themselves. They might know how to button the button or tie the shoes. But my caregivers, I want you to always realize that you're caring for an adult. This is a wonderful adult that through their entire course of life have done for themselves. Not only grooming, dressing, the basics of life, but things like driving and meeting the responsibilities of their life. Unfortunately, because of many times the functional loss associated with Parkinson's disease, the more difficulty with the dexterity, the weakness, the fatigue, they need more help. So I want you to understand when you're helping somebody with Parkinson's disease that you set them up for success to do for themselves. You are dealing with an adult. You're not dealing with a little child. So you have to give your loved one during the course of everything the opportunity to make decisions. A big thing with living with chronic disorders is your sense of loss of control. And I always feel that if you have a decision to make, you have a sense of control over that moment or over that choice in your life. So I want you to approach your loved one with choices. Little things like, do you want to wear the blue shirt or the red shirt today? Or would you like to wear your tennis shoes or your loafers today? These are choices that you're giving them to make during the course of the day. You don't want to come in and mandate, just wear this, hurry up, put it on, and we're out and about. So I want you to give choices, put everything in front of them that they can do for themselves, dress themselves, groom themselves, allow plenty of time to do it. It's very common for caregivers to jump in. You consider it an act of love. It's really not. If you come in and automatically do for someone, take away their choices, automatically dress them and tie their shoes, you're robbing them of, number one, the choice, and number two, the ability and the opportunity to do for themselves. So when it comes to grooming and dressing, you want to offer choices. You want to lay everything out in front of them that they can dress themselves, groom themselves. Gentlemen, it can be the tie, it can be the belt, it can be the watch, it can be the shaving gear, whatever. Ladies, it can be your jewelry, it can be your makeup, it can be anything that you need in front of you to do for yourself with regards to grooming. Caregivers, you only offer help when it is requested. So you can say to your loved one, it looks like you're having a little bit of trouble with your buttons today. Do you think I might be able to come on in there and help you with that? Or give me a call, if you're struggling too long with that, and if I can give you a hand. You're offering the opportunity for your loved one to ask for help. All right? The same thing with showering. You want to be there. Showers, most accidents happen in the bathroom. But the ability to be in the shower, to wash yourself and dry yourself and take a shampoo. That's all critical as long as your loved one is set up for safety. So you want to always use the shower chair, the bath mat. If you can get one of those shower nozzles that come off, that's a little hose, you can allow your loved one to go into the shower and to do absolutely as much as possible for themselves, and then you be on standby to keep them safe and to finish what maybe their back or whatever that they're not able to do for themselves. So you work as a team, you do as much as you can for yourself, you're there to help and to assist and to keep safe, but allowing, once again, with the bathing process and the grooming process, to do as much as possible for themselves. Human beings, we want to do for ourselves. We want to do our hair, we want to shave ourselves, we want to put on our own jewelry. So whereas you're there to offer assistance, you patients, you take ownership in doing as much as you can for yourself every day with your grooming, your dressing, your bathing, okay? And caregivers, you be on standby for the added assistance and the safety feature. With regards to using the bathroom with toileting, we all like our privacy. And so you help your loved one with the toileting process or on and off the toilet, being there to assist when request has been made of you. I encourage you to utilize the lifted toilet seat, the grab bars. Sometimes you can have something that you can push up from the toilet seat so that you can allow your loved one to have as much privacy in the bathroom as possible, calling upon you when need be. Okay, so the activities of daily living, it's important that you set up for success, that you set up for independence, that you set up that do for yourself and call me if need be, because it all goes back again to the more you do for yourself, the more esteem and the pride and the confidence you have in yourself. So relating to your loved ones, speak to them as if they were an adult. Don't automatically jump in and do just because it's faster and easier for you to do it, okay? When it comes to eating, many times we know that the dexterity of cutting food can be difficult for some. The dexterity in the hands many times is lost with the stiffness, the rigidity, the weak muscles. So it's very important that you set up the dinner plate, that you may have already cut the meat or prepared the foods so that your loved one can eat independently once the meal is presented to them. I always encourage the use of finger foods, foods that are easily managed. I always say it's a lot easier to eat a tuna fish sandwich than it is to eat a dozen unpeeled shrimp. So caregivers, when you're preparing foods for your loved ones, you want to present them with the foods that, number one, they can handle. They can handle a sandwich. They can handle the fork. They can handle a spoon with mashed potatoes and foods that are easily managed. Also, please be remembering that many times with Parkinson's disease, you do have a problem with the swallowing issue. So we want to pay a lot of attention to preparing good, healthy, solid foods for your loved one in a form that they can manage if along the way they have more issues with the swallowing of certain foods. So whereas, it might be difficult to handle steak, you might want to cut that very fine. If it gets to the point that puts your loved one at risk, then you want to go on and enjoy, roasted chicken, the fish, the meatloaf with gravy, things like that. You want to constantly set your loved one up for success so that they can successfully feed themselves and enjoy happy, healthy meals. Don't put foods in front of them that you know that they're unable to cut or unable to manage. You want to prepare the platter, in the kitchen, and then present it at the table in a form that they can feed themselves and feel successful with the normal eating process, which we've all done since we've been children. If spills are an issue, then spills are an issue. Then I want you to utilize, some sort of a bib or something here to protect the garments, whatever it needs to happen. But the bottom line is you want your loved one to be eating, to be feeding themselves, to be enjoying their favorite foods. Stay aligned with the normal healthy foods. But maybe they can't handle a raw apple, but they can handle applesauce or stewed apples, things like this. You want to continue to nourish them with the greatest amount of beautiful assortments of foods with all the vitamins and the minerals that they need, right? So once again, with the food, you have food prepared that they can swallow, that they can manage. There's a lot of wonderful adaptive devices with regards to eating utensils that can be utilized. Maybe a fork becomes difficult, but you can get an adaptive spoon so that they can continue to feed themselves and to be functionally independent at the dining room table or at the breakfast table. Always offering choices. This is a wonderful thing to anybody, is to have the choice to make your own decisions. It's the greatest way to seed and feed esteem and confidence. So instead of saying, so you might want to say at breakfast time, would you like to have orange juice or apple juice? That's a choice. Or would you like to have oatmeal or scrambled eggs? That's a huge choice. Allowing your loved one to take ownership in their life and to make choices based on their wants and on their needs is a great way to do it. Conversations, the way that we talk to each other, is very, very, very important. The need to constantly motivate and to empower and to bring attention in a kind and loving way to anyone living with Parkinson's disease is probably the greatest gift that you can give someone. Always giving positive affirmations and credit and tribute. Gee, you did a great job with that, or I'm so pleased that you were able to dress yourself completely this morning. What a great job you did, and you just really look terrific. So the need for positive affirmation, building someone's esteem through conversation and through kind words is huge. I'm always a believer that if you can't say something kind and affirmative and loving to someone, you're better off to say nothing. My caregivers, the higher level of esteem and confidence and happiness that you can keep your loved one, the greater life is going to be for you, because your role is to make a positive contribution in the life of your loved one. This is someone that is a huge part of your life. You want to see them accomplished and independent and happy this day, doing the most that they can for themselves on the highest level of motivation and of really celebrating this day. So the highest level that you can keep them through nurturing, loving, motivational words, encouragement, the better it's going to be for them, and the easier this day is going to be for you. So that the greatest role of a caregiver is not the physical part, but the need to motivate and to encourage and to keep your loved one empowered and proud of themselves, no matter what level they are or what stage they are along the course of the Parkinson road. So the goal is to work together in a conversation that keeps you up and moving forward on a positive note. Now, my patients, I want you to be equally conscious of the fact that there's a lot that you can do to empower and to motivate your caregiver. The role of a caregiver is great. The burden is heavy. You can become overwhelmed, overtired, overstressed very quickly. And when you carry a heavy burden, when you become stressed beyond healthy limits, it can wear you down, and it can wear down your esteem and your confidence and your joy for life. So my wonderful Parkinson patients, I want you to take equal ownership in what can I do this day as an equal partner with my caregiver to make it as easy as possible for the one that's dedicating their life, putting you first, basically the caregiver. So I want you to reach out and say, how are you doing? How are you feeling? What can I do for you today? Or what can I do to help you today? Or I'm noticing, that you've been in the house all week, and I think it might be a good idea if you go out and do some things that you like to do, so that you can feel more positive, more motivated, and a more higher level of esteem and joy for life. So the need to maintain esteem and dignity and empowerment is probably the greatest partnering that you will do with a patient-caregiver relationship. It's critical for the Parkinson patient to feel empowered and to feel good about themselves, because I always say that what Parkinson's disease can do, and it can really alter a lot in your life, physically and emotionally and mentally and socially, but the things that make you great, this disease cannot touch. It cannot touch what makes you a great human being. It cannot touch the wonderful qualities that make you loved by your family and your friends and your colleagues and by all the people that share your life. So you need to hold on to that, and you need to hold on to your life and hold on to your esteem and hold on to your confidence so that you can stand tall with Parkinson's. This is a disease that you cannot do it. You cannot meet and greet the overwhelming challenges that you face every single day as a patient or as a caregiver. You cannot do that on your emotional knees. You cannot do that if you're down low. I always say lower than a snake's belly. You're bottom out, The only way that you're going to meet and greet the challenges of this day and face the day with joy and celebration is if you're standing up, if only in your mind. So the only way that you're going to be standing up is if you enjoy a sense of esteem and of dignity and of courage and of empowerment as you face your life today and tomorrow with Parkinson's. So you want to work at it through yourself, because you can't give away what you haven't got. And if you're not feeling strong and confident and dignified, then you can't give it away to your loved one or to your caregiver. So it's probably the most important thing, the most important effort, goal that you have living with Parkinson's disease is to realize I've got Parkinson's does not have me, and it's just Parkinson's, and I'm still the same wonderful person that I always have. I just happen to be living day by day with the physical and emotional challenges of this disease. So really pay attention to how you're feeling about yourself. What do you see when you look in the mirror? What do you see when you look in the mirror? I don't want you to see the obvious side effects, the symptoms of the disease. That really doesn't matter that much. Look behind your eyes to the wonderful person that you are, whether you're a patient or whether you're a kind, loving, dedicated caregiver. And realize that the more you do to seed and feed self-esteem and confidence, the stronger you're going to feel, the more joyful you're going to feel toward your life, the more ability you're going to have to face each day with joy and with celebration, because that's the name of the game. We have this day. We don't want to lose it. We don't want to spoil it. We want to have a good time. We want to get out and about and enjoy family and friends and activities. One of the greatest things that you can do is to get up and get dressed and get out of the house. If not every day, every other day. It's why we have Parkinson Place. You can come Monday to Friday to wonderful activities here in Sarasota, that you can stay engaged, that you can do good things for yourself. The more you do for yourself, the more under control you will feel. The more under control you will feel, the more positive and empowered and confident you will have in yourself as you move forward day by day with this disease. Doing things like exercise, Tai Chi, dance, going to educational programs, ask the doctor, my motivational programs. These are things that are going to keep you ahead of the game. They're going to give you the ability to say, I am standing tall, I am standing up to Parkinson's. And this is something that you have to do for yourself. You have a lot of people in your life that love you and care about you, but your life belongs to you. And your ability to stand up and face Parkinson's disease initiates from inside of you. So your will, your motivation, your empowerment is in there. Everything that you need to meet and greet Parkinson's disease is inside of you. It's hiding out in your toes, but it's in there. So I want you to pull it up, and I want you to use it. I want you to look in the mirror and love what you see. The same extraordinary human being that you always were, just happened to be living day by day with Parkinson's. But everything that made you great is there. I want you to hold on to it. I want you to empower yourself along the way, step by step, during the course of your day, to eat right, to have good thinking, to have a positive attitude, to reach out, to build a kind and loving, respectful relationship with your caregiver and the people in your life that know and love you. I want you to do for yourself as much as you possibly can. Ask for help when need be in a kind and loving, respectful manner. Because you can do this. You can do it. Anybody can live well with Parkinson's disease, because everything you need is tucked safely inside of you. So pull it out from your toes and use it.